Sunday, everyone. I am Michelle Gador speaking, and this is my partner, Jayla Parandali. And we are assigned to report about the artificial methods such as transdermal patch, vaginal ring, subdermal implants, and hormonal implants. So let's begin. Let's go.
So these are the types of artificial methods for birth control. So first, let's discuss about transdermal patch. Transdermal patch is a patch that attaches to your skin and contains medication. The drug from the patch is absorbed into your body over a period of time. If you'd rather not have a pill or an injection, a patch may be a more comfortable option for taking some medication. It is also used to deliver a range of drugs into the body. Some of the drugs more often used in patches includes fentanyl. So what is fentanyl? So fentanyl is to relieve pain. Nicotine is to help with quitting smoking, and clonidine is to treat high blood pressure. So, transdermal patches provide a non-invasive and painless method of drug delivery, with the added benefit of providing a constant and consistent therapeutic dosage over a predetermined time period. So, there are two types of transdermal patch drug delivery. So, first is the passive transdermal patch. Passive transdermal patch drug delivery systems are those that rely on natural diffusion to transfer drug from the patch to the skin and into the body. They provide a consistent diffusion rate depending upon the characteristics of the skin and the design of the patch. The second one is the active transdermal patch. So, active transdermal patch drug delivery systems are those that use a specific method to aid in the transfer of drug to the skin and into the body. These methods include chemical enhancers and primators, physical aids like microneedles, and low electrical current like control-phoresis. The amount of diffusion depends on the active method used, the drug characteristics, and the skin. So, there are also advantages and disadvantages of transdermal patch. So, the advantages of transdermal patch is it is simple to use and it used by just one partner. Needs to be applied only once a week and not in relation to intercourse, improving patient compliance. Does not detach with exposure to water or sweat. May improve bone strength due to the estrogen content. May reduce the risk of benign breast disease as well as uterine, endometrial, and ovarian cancers. So, these are also the disadvantages of transdermal patch. It does not provide protection against sexually transmitted infections or STI, including HIV, and must be prescribed by a healthcare provider. The return of fertility may be delayed by up to 2 months after stopping the use of the patch. Skin irritation may occur in some women. In using transdermal patch, it also has a minor side effects such as headaches, hypertension, nausea, breast tenderness, depressive mood changes, intermenstrual spotting or bleeding, and vaginal pruritus or discharge. So now, let's discuss the second one called vaginal ring. So, what is vaginal ring? Vaginal ring, it releases a combination of estrogen and progesterone and surrounds the cervix. This silicone ring is inserted vaginally and remains there for 3 weeks. then remove on the fourth week as menstrual flow would occur. The woman becomes fertile as soon as the ring is removed. The estrogen prevents your ovaries from releasing an egg, while the progesterone thickens cervical mucus to make it harder for sperm to reach the egg. So, facts about vaginal ring. If used correctly, the vaginal ring is more than 99% effective. You can continue to have sex when the ring is in place. A few women develop a blood clot when using the ring, but it is rare. The ring can sometimes come out on its own, but you can rinse it in cold or warm water and put it back in as soon as possible. So, vaginal ring also has these advantages and disadvantages. So, the advantages of vaginal ring is it is easy to put in and take out. The ring isn't affected if you're sick. It may help with premenstrual symptoms. Also, the disadvantages is you can have spotting and bleeding in the first few months. It may cause temporary side effects such as increased vaginal discharge, headaches, nausea, breast tenderness, and mood swings. The ring doesn't protect against STIs. Using the vaginal ring, a woman can encounter some risk like blood clots and cancer. So blood clots, a very small number of people using the vaginal ring may develop blood clot in a vein or an artery. Don't use the ring if you've had a blood clot before. Cancer. Research suggests that women who use vaginal ring have a small increased risk of being diagnosed with breast cancer compared those who don't. But this reduces with time after you've stopped use the ring. Also, it increased the risk of developing cervical cancer with long-term use of estrogen and progestogen, hormonal contraception.
So the third types of artificial methods is subdermal implants. So any idea what is subdermal implants? Anyone? So subdermal implants are two rod-like implants embedded under the skin of the woman during menses or in the seventh day of her menstruation to make sure that she is not pregnant. It contains etonogestrel, disogestrel, and progestin. Subdermal implants it's effective for 3 to 5 years. It is also involved the delivery of a steroid progestin from polymer capsules or rods placed under the skin. The hormone diffuses out slowly at a stable rate, providing. So there are the advantages and disadvantages of subdermal implants. The advantages is safe during lactation, reduce the risk of pelvic inflammatory disease due to the thick cervical mucus, which prevents microbes from ascending from the vagina into the uterus. The disadvantage is it offers the protections against sexual transmitted infections or STIs. Immediate protection may not be available in all situations, and another mode of effective contraception must then be used for at least 7 days following. So there are some questions that women asking about the subdermal implants, like how long does subdermal implants last? How effective subdermal implant? What are the side effects of subdermal implants? Are subdermal implants permanent? Or does the implant stop periods? So the answer of all of that question is The implants provides effective conception for up to 2 years. Also, in some studies, efficacy persisted up to 5 years. The implant is one of the best birth control methods out there. It's more than 99% effective. That means fewer than 1 out of 100 people who use Nexplanon will get pregnant each year. Uh, the side effects of subdermal implants is nausea, stomach cramping or bloating, dizziness, headache, breast tenderness, are lost, weight gain, and vaginal irritation or discharge may occur. And the the part hardness typically has holes in it for the skin to help into making the implant permanent. When it's first put in, you may feel some bruising, tenderness, or swelling around the implant. Your periods may become irregular, lighter, heavier, or longer. A common side effect is that your periods stop um, intramuscularly. So the fourth types of hormonal and types of artificial methods is hormonal injections. So hormonal injections, it consists of medrocyprogesterone and given once every 12 weeks in intramuscularly. The injections inhibits ovulation and causes changes in the endometrium and the cervical mucus. These are the advantages and disadvantages of hormonal injections. The advantages is you do not have to remember to take a pill. It's safe to use while you're breastfeeding. It may reduce heavy, painful periods and help with premenstrual symptoms for some women. The disadvantages is your period will change and become irregular, heavier, shorter, lighter, or stop altogether. This can carry on for some months after you stop the injections. Some people may put on weight when they use Depo-Provera of cyanoprase contraceptive injections. Any side effects can continue due as long as the injections last 8 to 13 weeks and for some sign after. Uh, there are some questions that women asking about the hormonal injections, like how effective hormonal injections? How many weeks should hormonal injections be used? Though hormone injections stop periods? The answer is here. If used correctly, injection is more than 99% effective. It lasts for 8 or 18 weeks, depending on which you have, so you do not have to think about contraception every day or every time you have sex during this period. It contains a type progesterone hormone. Depo-Provera shoots provide protection against pregnancy for up to 14 weeks, so you typically need to receive one shoot every 12 weeks. Also, Depo-Provera is effective at preventing pregnancy. It does not protect against sexually transmitted infection or STIs. The injections or depot is given as an injections into the button or site every 3 months. It contains a hormone called progestogen, which is very similar to the body's own hormones, long-lasting and convenient. It can stop periods temporarily. So these are the 4 types of artificial methods that we are discussed, and we are ending here. Thank you and God bless.